Okay, let's jump right into this really important explainer on postpartum psychosis. This is a sensitive topic, but it is absolutely critical. Whether you're an expecting parent, a supportive partner, or just part of a family's village, understanding this condition is vital. We're going to approach this today with compassion, clarity, and the latest medical know-how, so you have exactly the facts you need. So here's our agenda for today. We're covering 1. The postpartum spectrum, 2. Understanding the risk, 3. Spotting the warning signs, 4. A true medical emergency, 5. Taking immediate action, and finally 6. Treatment, recovery, and hope. By laying out this roadmap, we want to reassure you right from the jump. We're definitely going over the warning signs, but we're also diving into the actionable steps you can take and the very real, highly successful path to recovery. All right, Section 1. The postpartum spectrum, navigating the days after birth. To kick things off, we really have to acknowledge that the postpartum period is tough for almost everyone. But there is a massive difference between typical mood changes and a severe medical crisis. At its core, postpartum psychosis, which you'll often hear called PPP, is a rare but serious mental health emergency. It usually pops up in the days or weeks right after childbirth, and it involves a sudden loss of the sense of reality. This is vastly different from the common baby blues, which is usually just mild mood swings and feeling tearful. PPP is a severe, sudden psychiatric shift. There is a really clear distinction in severity here. Postpartum depression is pretty common, affecting about 1 in 8 women, and it brings this persistent sadness, exhaustion, and anxiety. Postpartum psychosis, on the other hand, comes on rapidly, sometimes within hours or days of giving birth, and it brings intense confusion, hallucinations, and a total disconnect from reality. Moving on to Section 2, understanding the risk. Who is most affected? Let's take a look at what the data tells us about who might be at the highest risk. So here is a crucial takeaway. Postpartum psychosis is rare. We're talking 1 to 2 in 1,000 people who give birth. It's highly uncommon, which is honestly exactly why it can be so shocking and terrifying for families when it actually happens. Now, while it's rare overall, certain factors dramatically spike that risk. For instance, if a mother has had a previous episode of PPP, her risk for future pregnancies jumps up to about 50%. A personal history of bipolar disorder or schizoaffective disorder, that carries around a 20% risk. And even just having a family history, like a mom or a sister who went through it, increases the likelihood. But, and this is absolutely critical, we have to emphasize this, postpartum psychosis can happen to anyone. Even someone with 0 prior mental health history can suddenly develop it. The intense hormonal shifts and the sheer stress of childbirth can literally trigger it out of nowhere. Section 3. Spotting the warning signs. Red flags for partners and family. You see, because a mother experiencing this is losing touch with reality, she probably won't realize she's unwell. So partners, family members, friends, we're talking directly to you here. You're the first line of defense. These symptoms are intense, and they escalate so incredibly fast. You might notice rapid mood swings, paranoia, or severe confusion. But a massive red flag? A sudden inability to sleep. And we aren't talking about being kept awake by a crying newborn. We mean feeling literally 0 need for sleep, sometimes going for days without resting at all. You might also see delusions. And what does that actually mean? Well, it's holding intense false beliefs that aren't based in reality. A mother might think the TV is sending her secret messages, or tragically, she might believe she needs to protect her baby from some imagined threat. These beliefs feel entirely real to her. She might also have hallucinations, seeing or hearing things that just aren't there. Section 4, a true medical emergency, why waiting it out is dangerous. It's crucial to understand why spotting these signs means we've crossed the line from a tough postpartum recovery into an immediate medical crisis. What makes this so incredibly tricky to navigate is that the symptoms wax and wane. A mother might have a perfectly rational, organized conversation with you, giving you this false sense of security, right? But then, just an hour later, she could plunge straight back into severe confusion or bizarre beliefs. The bottom line is that without treatment, losing touch with reality carries tragic, life-threatening risks. Research shows that if left untreated, there's roughly a 5% risk of suicide and a 4% risk of infanticide. These statistics are heartbreaking, but they are exactly why you can't just say, let's wait and see how she feels in the morning. Section 5. Taking immediate action, your emergency roadmap. Okay, let's get into the exact, actionable steps you need to take if these frightening symptoms pop up.
When the stakes are this high, what is the safest, most effective way for you to respond? Let's break it down.
By following these 3 steps, you can safely get from recognizing the symptoms to getting professional help. Step 1. Seek emergency care immediately. Go to the ER or call 911. Don't wait for a regular doctor's appointment. Step 2. Stay with the mother. Do not leave her alone. And step 3. Make sure the baby is safely cared for by another adult so you can focus entirely on the mother's medical needs.
I do want to quickly pause and mention that this explainer is strictly educational. If you're concerned about a loved one or yourself, please contact a healthcare provider or emergency services immediately for an actual diagnosis and help. Finally, Section 6, Treatment, Recovery, and Hope. Postpartum psychosis is highly treatable. Let's talk about how all of this leads to a message of concrete hope, because honestly, there is a very bright light at the end of this tunnel.
The reality is that with immediate hospitalization, often in specialized mother and baby units, and the right medications like mood stabilizers and antipsychotics, this is highly treatable. Throw in solid psychiatric evaluation and outpatient support, and the vast majority of women experience a full recovery and go right back to being the wonderful parents they intended to be.
We cannot say this enough. Experiencing a psychotic break after birth is no one's fault. It is a profound medical event, not a character flaw. It's driven by biology and hormones, and it deserves compassion, not stigma. Getting a mother the help she needs is truly the greatest act of love.
If you need support, emergency rooms, OB/GYNs, mental health professionals, and crisis teams are fully equipped to handle this. They know exactly what to do. You absolutely do not have to navigate this alone. Postpartum psychosis is rare, but it is highly treatable. We really hope this explainer equips you with the knowledge you need, but I want to leave you with this final thought. Your awareness could literally save a life and keep a family whole. Will you be ready to recognize the signs and protect the mothers in your life?